leading cardiologist from India, talks about his education and experience. He did his fellowship from Wisconsin, the USA, and training from the United Kingdom. His specialties include interventional procedures and electrophysiology.
I have done my education in PGI Chandigarh, my MD in medicine and DM in cardiology. Thereafter I went out of India and I done my MRCP from UK. And after doing my MRCP in UK, I came back to India. I have studied in UK where I completed my MRCP. Then I came to India, then went back again to United States to do my electrophysiology fellowship in Wisconsin, Milwaukee. There I trained myself for radiofrequency ablation and various device implantation like pacemakers, ICDs, and combo devices. My basic interests are interventional cardiology, where I do angioplasty and other interventions. And then my another interest is electrophysiology, where I do the RF ablations and the device implantations, like I said earlier, pacemakers, ICDs, and combo devices. And of course, the radiofrequency ablation is one of the main procedures which I carry at this hospital. Pacemakers are usually, a pacemaker is a device which is required to prep up the pulse rate. If the pulse rate drops because of some reason, either that the electrical activity is not being produced by the heart, or there is some kind of block and routed to the lower chamber of the heart on the way. So in both these situations, the pacemakers are required, which guarantee a minimum heart rate to the patient. These days, whenever you do a balloon angioplasty, usually it is accompanied by a stent implantation, because it's been seen in early 2000 or so, or even in 80s, 90s and 80s, that whenever you dilate a blockage with balloon alone, the chances of coming it back within 6 months are very high. After the stent came in, now what we do is we dilate the area of blockage with the balloon, and then we implant a stent at that place. And after the stent is implanted, now it has been seen that the chance of recurrence have decreased a lot. In the year 2002, there was a further development when the drug-eluting stents came, drug-coated stents came, where there is a medicine on the impregnated on the stent, and that prevents reoccurrence or growth of tissues inside the stents. So nowadays, the stents which are being used all over the world, majority of these stents, I would say 70% or 70 to 80% in some of the organizations, are stents which are coated with drugs. They are called drug-eluting stents. Patients I have treated coming from Nigeria, coming from Kenya, and a lot of patients come from Bangladesh and Nepal. These are the local kind of international patients, but like Botswana, Nigeria, Tanzania, the patients have been coming from those areas, either with the coronary artery disease, with blockages requiring angioplasty, or some of them they have required high-end device implantations, like what we call as a combo device, which is a combination of a heart failure device and a defibrillator. Those patients have been given combo devices. We have all the latest modern medicine equipment, and all cutting edge technologies are available in this hospital. In fact, we here kind of get technology sometimes even before the United States of America, where the FDA has to pass a particular procedure which takes a long time. Here we can get adapted to that very soon.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.